Caroline. Good morning, everyone. I hope you had a great weekend. Spring has sprung, and the weather is warming up, so that's good news moving forward. The other good news is that thanks to everybody's efforts in this room and team, and thanks to each and every one of you, the residents and business community of the city of Springfield, we're in the yellow. So that everybody deserves a round of applause for that. We can't let our guard down, and we have to stay ever vigilant. And as the traffic lights, red is stop, yellow is caution, and green is go. And our goal is to get the green baby green. Before we start, I'd like to have a moment of silence for two individuals. One, Dr. Albert Garner, who was a good friend, and he just lost his wife, Jerry Garner, maybe a week to 10 days ago. Dr. Garner passed away with COVID-19, and just a true gentleman. And also to City Councilor Attorney Sean Curran's mom, Eileen Curran, who passed away last week. Can we just have a moment of silence, please? Thank you very much. On the stat sheet, total confirmed COVID-19 cases since the start of this onslaught, 18,783. Monthly, 948. Weekly, 310. Reports Commissioner Helen Colton Harris. On the deaths, and again, one is too many, we had 5 new deaths that occurred of Springfield residents. And again, our thoughts and prayers and encouragement, sympathy goes out to those affected families. That brings the total now to 232 Springfield residents who have lost their lives to the hands of COVID-19. Of that, the breakdown is 97 white, which is 41.8%. Black is 50, which is 21.5%. Hispanic is 78, which is 33.6%. Asian is 7, which is 3%. The breakdown, long-term care facilities went up by 1. It's the first time in a while. That's 60 for 25.8%. Residential is 172, which is 74.1%. Again, I'm very thankful that Dr. Mark Kerouac, the CEO and President of Bay State Health System, is faithfully here, as with Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, and their presentations will follow very shortly. And again, after their presentation, so they get back to their important duties, we'll take questions and comments from the media. I'd also like to thank Focus Springfield, and I want to thank the media, TV, radio, and print, for continuing to be a good partner in getting information out to all the residents of business community of Springfield and surrounding areas of Western Massachusetts. Of course, I want to thank the sign language professionals here. There'll be, I think, almost a year when we get in April that you've been here, so we appreciate that. And again, I want to thank you, the residents and business community of the city of Springfield, for your patience, your understanding, and your partnership as we move to defeat this COVID-19. Helen and I have been working very diligently for quite a while with Governor Baker, Lieutenant Governor Polito, Commissioner Monica Burrell, and Secretary Mary Lou Sutters to bring about neighborhood vaccination sites. Helen and I have pushed very, very hard, and we're very happy to report that those neighborhood sites will continue. Just last week, we're partnering with BHN, Behavioral Health Network, and CEO Steve Wynn to help address inequities in the lower Liberty Heights, and that'll be being announced very shortly. But again, Helen and I have stayed steadfast on making sure that these neighborhood vaccination sites are happening and will continue to happen, especially for our underserved population, brown and black. And then we'll continue to base on statistics on moving them around the city of Springfield. As you know, working with Governor Baker and Curative, and we're working closely with them for future announcements. The Eastfield Mall is a mass vaccination site, which I lobbied very hard for Springfield, is running very smoothly. AMR with Patrick Leonardo, the Director of Operations. Stop the spread testing continues at the Eastfield Mall. AMR has also been a good partner with Helen and I on the vaccination neighborhood sites. Helen will get more into that. We continue to our seniors in need that are homebound. We continue to make meal deliveries to our senior citizens. We continue our telephone banks through HHS, Elder Affairs, libraries, Sheriff Cochee, United Way Governor Baker, Palmina, 211, and Lieutenant Governor on appointments for vaccines. Governor Baker, as you know, we are now open to Phase 4, Step 1 today. That allows for some things to move forward, but please make sure you review that. All the information's out. Some of the major or larger type things cannot be done till Phase 4, Step 2. I want to congratulate our very own American International College, AIC, the Yellow Jackets, who came to visit me Friday. Coach Lang and a few of their skaters, hockey team, they won their divisional tournament. They're advancing to the NCAA Division I tournament, and we're hopeful that they make another run to the Frozen Four and a possible national championship. I believe they're playing North Dakota State this Friday, so go Yellow Jackets and bring it home. I also did a new segment, Mayor's Corner, with the Greater Springfield Realtors Zoom segment last week. Kevin Sears and team, appreciate that. St. Patrick's Day activities went very, very well. We had here at the Mass with Bishop Byrne at Sacred Heart Church, the flag raising here at City Hall, and at the Raymond A. Jordan Senior Center, we had the car parade, which was fantastic. I want to thank Sandy Federico and Helen Carlton Harris and the Elder Affairs, and Kerry Sullivan of the Springfield St. Patrick's Day Parade Committee. This week I'll also be doing a Zoom class visit to Dryden School, a third grade class. Ms. Deb Sherborne invited me to speak to the class on city government. I look forward to that. We'll be opening up another small business tomorrow morning, MC Salon, Cherie Wilson. That's a ribbon cutting at 1760 Boston Road, Haymarket Square. She's opening up a beauty shop there. Thanks, Cherie. I look forward to seeing you, and thanks for your belief and investment in the city of Springfield. It'll be a big week for all our Greek Americans. This week they mark or celebrate their 200th anniversary of independence. We'll do a flag raising this Thursday and a proclamation. I'll also be attending St. George Greek Cathedral Sunday for their 200th anniversary of independence Mass. Thank you, Lisa Pappas, on that. Also, a meeting with the new Red Cross Executive Director, Nina Renix. And I'm proud to say, maybe the apple doesn't fall too far away from the tree, but my youngest daughter, Kiara, will now be, I believe, the youngest board member ever with the American Red Cross, and very proud of that she's doing that. Oasis Food Bank continues to serve 3,500 families on Fridays at Central High School. With schools going back, and Superintendent Warwick will give you the update on our schools, we will be looking to move that Oasis Food Bank in the near future to another large area. My Chief of Staff, Tom Ash, is working with that, with John Foley and Tedesco and the Food Bank of Western Massachusetts. So stay tuned on that. There'll be an announcement coming when it has to be moved. The old Brookings School, and there's been quite a transformation in the Central Street quarter, and Director Signola, I know that the traffic reconfiguration and roadway work is going on. The groundbreaking will be, I believe, this coming Friday with Home City Housing, Tom Kegelman, Workforce Housing, and Tim Sheehan, Chief Development Officer Tim Sheehan and I will be there, and that's another important project being done here in the city of Springfield. State delegation meeting. I'll also have Rep. Pupolo bringing in the Taiwan Consulate Director General Jonathan Sun. Matter of fact, they donated a couple months back, or a little farther back, tens of thousands of masks and PPEs to us. So it'll be good to see the Director General Jonathan Sun. We'll also be celebrating, I think this Friday, 85th birthday card parade. We'll say it a little earlier to Irene Sherrod up in the Old Hill area. So we'll look forward to seeing you Friday evening, Ms. Sherrod. Happy and healthy birthday. The Vietnam Veteran Memorial, we will stage a smaller type event this Sunday at 12 noon in Court Square, Veterans Walkway. And it is holiday season again. By the end of the week, Passover will start. So happy Passover to all our Jewish citizens. And Palm Sunday will be coming this Sunday. Quick update on the police. Commissioner Clapper will be more specific. They are down 2 with COVID. As Alan Funt would say on Candid Camera, smile because you're going to be on camera. We're going to continue our crackdown on dirt bikes. The eye in the sky will be out there, boys and girls. So smile as we grab those and arrest you, and hopefully we destroy them. That operation with the state police, and I'm very thankful to Commissioner Clapper and Major Habel, will continue. So be aware of that. Stay off my streets. We also had a demo done on Custody Protect, medical monitoring bracelets. Commissioner Clapwood and I saw, and we're hopeful to make an announcement of use of that for health aspects of individuals that have to be taken in. City Councilor and State Rep. Orlando Ramos, I appreciate, he's put in that gasoline station ordinance on dirt bikes, and we look to move that. Department of Justice meetings, DOJ meetings continue. I'd also like to thank the City Council. They finally passed ordinance or home rule that I put in. Thank Councilor Victor Davila. It's passed, put some teeth on enforcement. We're trying to be proactive on the dirt bikes and the fireworks, so thank you on that. At a Commonwealth Avenue, Lower Commonwealth Avenue shooting this past weekend, and lo and behold, those individuals are non-cooperative. Police will continue to pursue, and we're going to be hitting that area. And subsequently, the Commissioner will update you on an AK-47 by the old Our Lady of Hope Church, which possibly could be some type of retaliation. You'll see with some of the names that have popped up, these are individuals that it just boggles my mind. I am bewildered why they are on the streets. Our courts let them back out. We continue to arrest these serious repeat criminal offenders gun charges, shootings, and they're out in the streets. And you'll see that when the updated reports come on this. Overall, crime is down 20% here in the city of Springfield. That's a testament to Commissioner Clapper and our dedicated and brave men and women in blue. Up are those gun assaults. And we arrest those people, and the courts let them right back out on the streets. That's the only uptick. And that's a serious uptick. So we need the courts to be our partners and keep these gun-toting criminals locked up. That's what my neighborhoods and I and the police demand. Very aggravating when you see these names that come up. Fire Department Commissioner Calvi indicates to me that we're down 3 with COVID-19. We had a very nice academy graduation up at the State City facility in the Orchard. And it just was heartbreaking that we couldn't have families there yet, but we live streamed it, and I thank Billy Baker of my office so the families could see that. I was on scene with Commissioner Calvi, and he's a hands-on commissioner. Friday evening, Woodlawn Street. Tremendous job they did walking a tightrope right up on the roof and knocking down that blaze and not letting it spread like dominoes to the other houses there. So Commissioner Calvi and to your men, tremendous job Friday evening on Woodlawn Street. Thank God no one was hurt, residents and or firefighters. DPW Director Chris Signoli is down 1 with COVID. Pothole work continues, street sweepers are out. Yard waste will start March 30th pickup. He's still in need of CDL drivers, so if you a licensed CDL, we're interested in on you. Superintendent Warwick indicates on meals served, $6,697,080. Weekend, we served 79,500. School committee meeting this week, and we'll be discussing the return that will be April 5th, and also that there's an agreement with the teachers to come back. Superintendent Warwick will go into that. State Education Commissioner Jeff Riley has granted us the hybrid waiver to start that transition of going back to school, so we're very appreciative of that. We had a school empowerment zone board meeting last week, and like we're going to do with our whole system, there'll be an emphasis on mental health counseling and extracurricular activities for when our children, our students, get back into school. Finance, my CFO TJ plan indicates to me since this has started, we've lost or we're down $8.5 million. The deficit for FY21 is $3.6 million. Deficit spending and grants is $34.8 million. Of that, 8.5 again is deficit, 25.5 we've been able to pawn off on grants. We continue the budget development for FY22. My public budget hearings will be announced very shortly, and we continue to review the federal stimulus relief package, and to be announced, to be determined on another cabinet heads meeting with Congressman Neal, and we appreciate his efforts. Parks and facilities, Director Sullivan, nobody is down with COVID-19. That's fantastic. I had a Highland rail trail briefing as McKnight and East Forest Park. That's going to be moving along. Patrick continues to work very closely with Superintendent Warwick. They continue to retrofit our schools and our municipal buildings. He also continues to work very closely with Commissioner Helen Carlton-Harris as we strategically start to locate neighborhood vaccination sites. Also with Sheriff Coachy and Commissioner Clapper, that MOU, I believe, is just about signed. We'll have the sheriff's crews, police back in our park system, especially our larger parks, starting ASAP. We're starting finally the study about the window improvements here at City Hall. I mean, we have such a beautiful historic City Hall complex, architecturally one of the best in the nation. So Pat Sullivan, thank you, and the Historic Commission on the state level, Secretary Galvin, on that study on how we can continue to preserve and improve the windows. Echo Dev, Director Tim Sheen indicates COVID-19, nobody's down. Met a nice young man, Marcos Gonzalez, Springfield resident. He came on board, he's a veteran, and he's going to be doing some economic development consultant work for us. A nice young man. Met him Friday with Tim Shop. Timmy continues to review the federal stimulus and relief package and how we can help out our businesses. Timmy will also speak to you about the Minority Technical Assistance Certification RFP that we're going to be putting out. He'll speak to you about national metrics on hotels and the GDP and the percentages that show a sign of hope. The Gemini site, we received one request for proposal. We'll review that, see the credence in that. Law, HR, and Labor, Solicitor Pakula continues with the Department of Justice meetings. The marijuana public presentations have gone on. I want to thank Billy Baker, my staff, my communications director, and Theo Hercules of procurement. They have been here on the evenings, being able so the public can see that. I'd also like to thank Bill Mahoney also with the teacher negotiations with Superintendent Warwick and coming to a tentative agreement to get our teachers and students back in the school. Attorney Mahoney indicates to me that the unemployment rate in Massachusetts just came out. It ticked up a little bit. It went up to 7.5%. Springfield, we're down. It's still high, but it's 12.2%. So with that, let me end and turn it over to the President and CEO of Bay State Health System, Dr. Mark Kerouac. Thank you.
Well, thank you, Mr. Mayor. Appreciate your holding these events, and good morning, everybody. Before I get started on COVID, let me just share that I'm going to be issuing a statement this morning in support of our team members of Asian American and Pacific Island descent. Among other things, it will say that hate has no place at Bay State Health and that we're committed to building an environment where everyone can feel that they belong. These communities had absolutely nothing to do with the pandemic, and the tragic shootings in Atlanta are all the more sad because of that. Moving on to COVID, we are seeing new case rates go down in Western Massachusetts, even with overall case rates inching up or staying the same in the rest of the state and in the country. We're seeing major surges in Europe and Latin America of new cases. New case rates here in the country seem to be stuck between 50 and 60,000 each day. There have been rises, dramatic rises in cases in both Michigan and New Jersey. However, a continued slow decline in hospitalizations and deaths. The deaths are at about 1,000 a day. And that is likely due to the fact that there's greater immunity in the elderly, the more high-risk individuals, and more spread among younger groups. In Massachusetts, the average number of new cases every day has been pretty flat at about 1,300 this past week. Deaths have been about 28 a day. Those are down. Hospitalizations down, roughly 600. Excuse me. The overall test positivity up at 2%, just slightly up. We have gone from 14 to 20 towns in the red zone, but most of them in the eastern part of the state. And congratulations, Mr. Mayor, Commissioner Colton-Harris, and everybody out there. Springfield's not one of them this week. Very good news. Chicopee and Southwick are still in the red. Hampden County is seeing declining cases, but is still number one among the counties since it's declining more slowly than others. At Bay State Health, we've been hovering around 50 for the last week or so, 52 cases this morning, 35 in our Springfield campus, 17 in our community hospitals, an overall case positivity rate of 3.6%, which pretty much matches the county. I want to say a word or two about the variant viruses, which have been very much in the news. These continue to grow in prevalence across the country and across the state. We're currently tracking 5 of them. There's the so-called UK variant, the South African one, the Brazilian one, and a couple of new ones from California and New York. The UK variant is now causing about 25% of the infections in the samples tested in one of the big labs in the eastern part of the state, BI Leahy. The labs across the state have seen only in the single digits of the South African or Brazilian variants, and none so far of the California or New York variants. We believe that the UK and Brazilian variants are more contagious. The others we don't know so much about. The UK variant also seems to be somewhat more deadly. The South African and Brazilian variants have some resistance to antibody against the virus in the lab, but it's not clear that that's important in clinical settings among vaccinated individuals. UK is not more resistant to antibody or vaccine, and it's kind of early to say very much at all about the California or New York variants. Although whenever one of these variants is increasing in numbers relative to the original strain, you've got to suppose that they are somewhat more contagious. So what I've been telling you has been a lot of maybes. You'll see a lot of experts on TV saying that they're worried about something, that something might occur. Most of what they're talking about has yet to be published in scientific journals, meaning that it has not gotten past a skeptical editor. Here's what would worry me about variants, which we've not seen yet. What would worry me is if there were failures of diagnostic tests, or if there were spread among vaccinated individuals, or if there were spread among those previously infected who had immunity naturally, or if there were failures of standard therapies. Any of those things would worry me a lot about these new variants, but we haven't seen it yet. It doesn't mean that some variant couldn't emerge that had one of these more worrisome properties, but we haven't seen it yet. The strategy to defeat any of these viruses is the same as the strategy to defeat the original one. Push hard on vaccination and continue to follow the public health measures. On the vaccination front, our program at Bay State Health continues in phase 2. Today, anyone over the age of 60 becomes eligible, with a broad number of workers, including restaurant workers, food service workers, grocery workers, transit, public health, sanitation, the court system, funeral directors. Those have all been added to the list that already included educators. Also, anybody with over 2 chronic conditions, 2 or more chronic conditions, and we are going to be gradually opening up to the point where all adults over 18 will be eligible beginning on the 19th of April. In the U.S., we're vaccinating probably the 3rd or 4th fastest of any country in the world at this point, which is pretty good. We've given out 124 million doses. Over 80 million people have gotten 1 dose. That's 32% of adults over 18 and 68% of the elderly over 65. And the rate is picking up speed, which I'm happy to say. We're regularly now giving out 2.5 million shots a day, which puts us on a pretty good pace. So I continue to be optimistic about the 4th of July picnic promise from the President. Massachusetts has administered 2.8 million doses, roughly 88% of what we've received. 1.9 million adults have received at least 1 dose, and over 1 million are fully vaccinated. We are maintaining our rate of about 50,000 shots a day, but I hope we can increase soon. We are expecting a large influx of vaccine in early April. The vaccine news of the day, of course, comes from AstraZeneca. They announced their United States trial that contained 32,000 participants. The vaccine shows 79% efficacy. However, it is unlikely to be available before May, and by then I think we're going to have plenty of supply from the other 3 that are already released. There have been concerns about AstraZeneca in Europe because of a few dozen cases of a blood clotting disorder, especially in younger women. This condition is rare, about 1 in 100,000 to 1 in a million administrations. But some of the European countries have reacted differently to this news. Some have paused their vaccine programs, but most have actually found the risks of the disease to be greater than the risks of the vaccine, so they have continued to resume. It's particularly so now that this rare side effect is recognized and can be treated. AstraZeneca is the major vaccine that's being given out in England, which has seen a 90% reduction in cases. It's actually one of the countries that's a little bit faster to the mark than the United States. They vaccinated about 40% of the adults. It is the major, they've done this, they've gotten this big reduction in spite of the fact that the majority of virus over there is the UK variant. AstraZeneca will likely have a role in getting the whole world vaccinated, which is an important thing because you don't want a lot of churn and replication going on for fear that some new and worse variant might emerge, but I don't see it playing a big role in the United States. At Bay State, we continue to administer about 600 to 800 shots a day, 5 days a week. Most of those are going to be second doses this week, but it varies based on the prior schedule. We do sub-allocate some to our community health centers here in Springfield, some to Franklin County, and some is earmarked for residents of the Springfield Housing Authority. I am happy to see that the neighborhood sites in Springfield are being opened under Commissioner Carlton Harris's program. That would be an important addition to what we're able to do. I suspect that by April we're going to have plenty of vaccine. The rate limiting step at that point is likely to be how fast we can get shots into arms or how hesitant people are to get the shot. It's concerning to see that a high percentage of people of color or conservative whites are indicating that they will likely not get the shot. In some surveys, that can be as high as 50%. I just wanted to share a couple of thoughts about vaccine hesitancy. The most common reason we see among our own team members is that I want to wait and see. I would make the point that we've given out 124 million shots, so it's not likely we're going to see any new surprises or new side effects from the next several thousand that we give out of the 3 that have been released. It's also known that over 95% of doctors have gotten the shot when eligible. And so this is obviously a group that has carefully considered the pros and cons. I would urge people to listen to our local doctors, who you can see in any of a number of venues, videos, print, etc., and other healthcare providers to understand the risks and benefits to you. These vaccines are safe and effective, and for some, even young people, COVID is a terrible disease. I'm very pleased that the Vax Force and Commissioner Carlton Harris are going to be getting the word out in a number of different public forums. If you've already educated yourself about the shot from a variety of sources, I'd consider becoming a vaccine ambassador. I would try urging those around you who are reluctant to get the vaccine, urging them to reconsider. Until you are eligible, remember there's still plenty of virus around. It's no time to relax on the public health measures of masking and social distancing and avoiding crowds, especially indoors. If you're already vaccinated, be aware that the CDC has said it's safe to be with other vaccinated individuals in social settings without masks or in single households where the younger adults are not yet vaccinated. They still recommend for vaccinated individuals wearing masks and observing social distancing when in public places or in larger gatherings. So that's my summary for the day, Mr. Mayor. I appreciate it, as always, the opportunity.
Thank you, Dr. Kerouac. Thank you very much, Dr. Kerouac. Before I bring up Dr. Russo, I'm glad Dr. Kerouac mentioned about our Asian Americans. I'll be involved in a rally on City Hall steps this Saturday, but just utterly ridiculous, the hate crimes of Asian American community. I just want to reaffirm, again, very respectful community, family-oriented, very industrious, business-wise, and their students do so well in our school system. So we will continue to stand with each and every one of you, our Asian American community. Thank you, Dr. Kerouac, for reminding me on that. And also with the Vax Force, I want to thank Commissioner Carlton Harris. We had our first town hall meeting. We're going to have more. That went well. The Vax Force, I think we're meeting again this week. And we're doing PSAs are going to start to come out to get people out about, why you need to get that vaccination. And for me, it's about forget the air hugs, being able to hug your family members or your close friends. Without further ado, I'll bring up the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, Dr. Robert Roos.
Well, thank you, Mayor. And I want to offer my congratulations and support to you and to Commissioner Carlton Harris and the entire team for bringing the city of Springfield to yellow and for continuing to push for green. I know we'll get there. I hope everybody had a nice weekend, had a chance to get outdoors a little bit, enjoy some of that spring-like weather. Seeing everybody outside biking and walking certainly reminded me of the summer and that time in which we saw very low rates here in our community. And it's a good reminder that being outdoors is one of the safest places to be as we make a final push to get infection rates down. With that, I want to thank everyone who's contributed to this effort of lowering the incidence rate here in the city of Springfield and in Western Massachusetts by continuing to follow the guidelines of masking and keeping a safe distance from others, whether it's in your private residence or in public, as well as for those who have been eligible for vaccine who have stepped up to receive it. We have heard that over 75% of residents over the age of 75 here in the Commonwealth of Massachusetts have been vaccinated. And those are the kinds of rates that we will need to continue to push for over the course of the next several months. This is indeed our shot of hope. And each week that we can move forward without a setback here in our community or across the state is a week that we are closer to getting back to the activities that we all crave and that we desperately need. This is particularly important now and also for the next several months. I'm not a runner myself, but I am a biker, and I was out on my bike this weekend and thinking a bit about this. We've been engaged in a marathon over the course of this past year. And to me, we're at the point in that race. A lot of people tell me that would be at about mile 20 or 21, where we start to hit that psychological wall, where the legs are tired, where the lungs are burning, where the mind is starting to go perhaps to a different place. But also, it's at that point in the race when you can start to see the end. You know that if you can push through for just a little while longer and make that final turn, you will finish successfully, get that runner's high, and complete something pretty incredible. We want to finish this race strong. The trends are positive, but they could still go the other way. I could prolong this race against time if we don't continue with some level of caution. At a national level, the total number of infections is approaching 30 million, and the deaths over 541,000. But the numbers of infections and hospitalizations are still continuing to decline across the country over the last 2 weeks. 9% decline in new infections, 17% decline in hospitalizations. But as was mentioned over the past week, the 7-day average of new infections has been about the same, right at that 50 to 55,000 per day. Here in Massachusetts, where there have been over 580,000 confirmed infections, there was actually some slight increases in the number of infections per day over the last week, and the test positivity crept up ever so slightly. The number of new cases went from about 1,100 to 1,300, and there was a few days over the past week where it crossed 1,500 and even 1,800. The test positivity bumped from 1.7 to 1.95%. Now, we're talking about small numbers in terms of the changes. I'm not really concerned about it at this point. First, and most importantly, it's because the hospitalizations and the deaths do continue to go down. That speaks to not only the effectiveness of vaccines amongst the most vulnerable, but the fact that the majority of infections are now amongst younger people who are less vulnerable. And secondly, I'm encouraged by the fact that the rate of vaccination continues to go up. And that's really the key driver of all the positive trends that we'll see going forward to help us get around this last corner. At Mercy Medical Center, we saw a bit of the ups and downs that we would expect as curves go up or go down. Our number of hospitalized patients did go up a bit this past week. After being down to 6 hospitalized patients for several days last week, as of this morning, we are back up to caring for 10 patients with COVID in our hospital, 2 of which are in the intensive care unit. I'm also not terribly concerned about that change. We know that this will happen. Numbers will go up and go down as a jagged edge to this curve. But it's a reminder that we are not fully through this yet. There is still considerable transmission of the virus throughout the community. Our test positivity rate at Mercy has actually bumped up again a little bit and is approaching 5%. It's at 4.7% this past week. And we are still seeing patients that are experiencing some complications. So all in, it's a reminder for us that we must continue to stay safe, just as we have been reinforcing that all along. It is also important as we turn this final corner that we stress the importance of you all staying healthy as well. This has been now a full year since the pandemic began here. And for many people, there were some of you who may not have seen your primary care provider as regularly or had those colonoscopies or those mammograms that you would have been ordinarily scheduled for. I'll be honest, my concern for people that have deferred or delayed these types of care or tests or exams is high. There's a lot of evidence now that people have delayed or deferred that type of care. And there have been some recently published review studies of the impact of that. One study looking at over 34 different studies, including over 1.3 million people, found that for every 4-week delay in surgical treatments for cancer related to an increase in the mortality and death rates. I urge you to not defer or delay any of those visits with your primary care providers or those screening exams. If you are in need of care, there is no better time to get it than now. You do not have to be concerned about capacity in our hospitals. You do not have to be concerned about safety protocols, as that has always been our top priority. We continue to perform, as everyone does, all types of care, from emergency care to primary care to imaging studies like mammograms, CTs, and MRIs, and surgical care. And as I announced last week at Mercy, we are allowing the support of loved ones in your care at the hospital. We continue to allow 1 adult visitor for all patients without COVID that are admitted to the hospital, are in our emergency departments, or are having a surgical procedure. Minors, those under 18, or women in labor are granted 2 visitors. And all visitors will continue to be screened upon entry and will be asked to keep their visitation within guidelines in order to keep those visits safe. Just as we've begun to revise some policies based on the fact that infections are going down and vaccinations are going up, so has Governor Baker. We know as of today, Massachusetts enters step 1 of phase 4. The Massachusetts travel order now becomes a Massachusetts travel advisory, which advises all travelers to the Commonwealth to quarantine for 10 days unless they have a negative test within 72 hours prior to returning, a negative test after returning to the state, or if the person is fully vaccinated. I personally think this is a fair and a logical change. It recognizes the effectiveness of vaccination, rewards those that have valued protecting themselves and protecting others. And it's important that we continue to be mindful of our travel, however, as it is mentioned that there are variants of concern and variants of interest for which the rates are increasing in certain states across the country, particularly California, Arizona, Florida, and as mentioned, New Jersey. Along with the change in the travel advisory, earlier in the week, Massachusetts Department of Public Health also issued their guidance on ways that people that are fully vaccinated can interact. This aligns with the CDC recommendations and states that for fully vaccinated people, they may visit with other people who have been fully vaccinated. But it also states that you must continue to wear a mask and keep a safe distance from others while in public, take precautions with those who have not been vaccinated, and follow the guidance on participating in any large gatherings like weddings or concerts. If you've been fully vaccinated, while you don't need to follow the travel advisory at this point, you should still do a few things. You should stay home if you are sick with symptoms that could be COVID and get tested. You should isolate if you do in fact test positive for COVID, and you should monitor yourself for symptoms if you do have a close contact exposure to somebody with COVID, even if you don't get tested or quarantined. All of these changes highlight and reinforce the fact that vaccines are extremely effective. They nearly universally prevent serious illness, and they do reduce the transmission of the virus. But they are not, and we have seen this, they are not 100% effective against all transmission. And there still are a minority of people in our community right now that are fully vaccinated. Most people are not fully vaccinated, and we must consider that, although the numbers are increasing. When we look at the numbers of those that are vaccinated now, more people are vaccinated each day. Over 2.5 million vaccines are going into arms across the country, which is promising. According to the CDC, over 124 million vaccines have been administered. Over 44 million people have received a full series. That's 31% of the adult population with one vaccine, but 17% fully vaccinated. The numbers are still small from where we need to get to, but each week we're adding another couple percent. Encouraging and important to prevent illness and disease. 69% of the population over 65 have received one vaccine, and 42% are fully vaccinated. And that is progress indeed. In Massachusetts, we've now administered over 2.9 million doses. 90% of the doses shipped here, over 1 million people fully vaccinated. And that's about 20% of the adult population over the age of 18 here in Massachusetts. So actually better than the state average. And from what I've seen, Massachusetts still ranks number 1 among states with more than 5 million residents in terms of the number of vaccines administered. We are very fortunate. We have 3 safe and effective vaccines that are available. We have a 4th vaccine, the Oxford AstraZeneca vaccine, for which the data was just reviewed and is also showing to be safe and highly effective. 79% for symptomatic and severe disease, and almost, just like the others, universally preventing any serious illness, and with no serious safety concerns. As mentioned, the schedule opens up today for eligibility for residents aged 60 and older and many essential workers, and then cascades quickly as vaccine supply increases so that all individuals over the age of 16 will be eligible for vaccination by April 19th. At Mercy Medical Center, we continue to provide 1,100 vaccines each week, utilizing Pfizer at this point for both first and second doses. As of today, we've provided over 11,500 vaccines, and more than 4,900 people have been fully vaccinated through our efforts. I want to commend the efforts of many people working collaboratively with the Vax Force, also specifically of Mayor Sarno, Commissioner Carlton Harris, so many others who are putting together efforts here in our community to ensure that we have the adequate supply, that we address vaccine equity and vaccine hesitancy, all of which matters significantly in the critical period of this time-sensitive rollout. But finally, I just want to remind us all, we only have a few more miles to go in this marathon, so if we can support each other and push through the fatigue, we will overcome there and win this race. Sign up for vaccination as soon as you are eligible. If you have questions, don't hesitate to reach out to somebody who you trust. Stay safe, remain vigilant. The virus may not go away, but we will win this race. Thank you.
Thank you, Dr. Roos. I know that the 22 news is here, Western Mass News here. Dr. Roos did a nice job answering over the weekend, all covered Matt, Fritz. So any questions or comments you might have with Dr. Kerouac or Dr. Roos?
does kind of seem like every few weeks we're seeing up with something new that's, to be afraid of to a certain extent. And another trend I've noticed is that we always need reports talking about antibodies as if they're the only part of the immune system. I don't know if this is overall immunology.
You sure? I'd love to.
I mean, if you want to, is there a point at which the virus would have to just evolve into something completely different and completely escape the immunological defenses that we are progressively building over the course of time?
Yeah, kidding aside, it is a good question. And I think that one of the reasons that I am not as afraid as the general public is, back when I was a young doctor, I actually did research on RNA virus transmission. It's important to figure how viruses get into cells. They have to bind to a specific protein. It's like a key into a lock, right? And you can't change that key that much and still maintain the ability to bind and enter cells. So the virus can change its shape a little bit, but it's not like it can do whatever it wants. These are not like bacteria that can live on their own outside of a human cell. So given that the antibody is so spot on to the binding domain of that spike protein, I think that it's unlikely that it seems to be binding to the most important part of the spike protein, that is to say the Moderna and Pfizer and J&J vaccines at least. And so there's not that much that the virus can do to escape. It might be able to wiggle around a little bit, but if it were to really change to completely defeat the antibodies, it also would defeat itself in being unable to bind to the entry protein. So that's about it. And then beyond the antibody thing, probably the best example there would be measles vaccine. Everybody's been vaccinated against the measles, but most people who would be tested for antibody would test negative. However, if they were challenged with the measles virus, memory cells would immediately begin to make antibody. And so that happens within a day or two of challenge, whereas for somebody who's never seen the virus before, it takes 10 days to 2 weeks for those first antibodies to form.
Is that also part of how, when we talk about the possibility that you have booster shots in the future or anything like that, is that part of the reason why the suspicion is that future encounters with infections wouldn't be as severe because
Correct.
the body is responding more effectively than it would have as a naive person?
So let's assume some new variant came out 3 years from now. The fact that you had seen the previous versions of the coronavirus would mean that you had a partially effective antibody response, which would make the amount of virus less and the disease less severe. That's also true for flu. One of the reasons that the flu of 1919 was so severe is that the human populations had never seen it before. I should say the younger populations had never seen it before. Old people didn't get as sick with that flu because they had seen previous similar versions.
And just to sort of build off of that, you mentioned that you would be worried about a variant for it to evade diagnostic testing. In that circumstance, would be the virus that needs someone that are diagnosed.
So I'm sorry, could you say that? I'm not sure I caught the question.
You mentioned that you would be worried about a variant if it were to evade diagnostic testing. In that circumstance, would it be because the virus mutated so much that it wouldn't be able to be picked up by the virus?
Correct. Many of the rapid tests that we have for virus right now are based on antibody binding to virus proteins. And if the virus protein changed so much that it wouldn't bind those antibodies, the test would render a false negative. And we'd see a lot of people with COVID-like illness that were testing negative. That would be worrisome.
Any other questions with Dr. Audrey?
One more, I just wanted to get your guys' opinion on the reopening. I know you mentioned that we're still supposed to be careful, keeping masks, staying distant if we're not fully vaccinated. Obviously, they're reopening certain venues, people and capacity, any concern whether or not that's right?
I think we've just seen that smart people can disagree about this. I think with case rates inching up in the state and in certain parts of the country, I am a little nervous about reopening more at this point. I think if you looked at the rates among young individuals, let's leave aside the elderly, leave aside young kids, right, and looked at, let's say, the 20 to 50-year-old population, the increase in rates of new cases would probably look more dramatic. That's just math, right? I suspect that, well, we may get away with it, but I think we need to be ready to pull back if we see an increase in cases. So it makes me a little bit nervous, this particular step, at this particular time, given where the numbers are going.
And I would just add, I kind of provided in my comments, I'm not particularly concerned at this moment with the slight changes that we've seen over the last week, but all throughout the last year, what has been the most important thing is that we always remain cautious. We stick with the guidelines that are put forward, and that we have the ability to respond to new information quickly. So at this point, no significant concerns about continuing to take the next step, but always listening to the science as it continues to evolve. And to me, that's where how I feel about it.
Any other questions or comments of Dr. Kerouac, Dr. Lewis? Okay, gentlemen, thank you very, very much.
Thank you.
Stay well from your family and staff. Thank you. We're now going to have the Commissioner of Health and Human Services, Helen Carlton Harris, come up to give her briefing. And again, Helen and I and the whole team have continued to try to offer you sure and steady leadership. And as we move forward, when you're out and about in public, as Dr. Kerouac, Dr. Roos, it is still important that you need to follow prerequisites, the masking, everything. But we are making progress. And soon we'll defeat this COVID-19. The Health Commissioner of the City of Springfield, Helen Carlton Harris.
Thank you, Mayor. Thank you, Mayor. Once again, thank you for your support. I will update with the data first. The Mayor has already given us our total number, 18,473. We did add 310 cases last week. Cases by date: Sunday 36, Monday 28, Tuesday 17, Wednesday 48, Thursday 65, Friday 73, and Saturday 43. So as you can see, Thursday and Friday we did see an escalation in our cases. However, they did come down on Saturday. We will be watching our daily cases every day, as we always do. Cases by age: 0 to 10, there were 40 cases. 11 to 20, 68 cases. 21 to 30, 59 cases. 31 to 40, 46 cases. 41 to 50, 39 cases. 51 to 60, 29. 61 to 70, 22. 71 to 85, 81 to 92, and 91 to 100, there were none. The increase in cases that we saw most was already articulated by the doctors. We have seen in the younger age cases increase. The ages where we're seeing the increase is that 11 to 20 and also that 21 to 30. By zip code: 01 had 2 cases, 1%. 03, 9 cases, 3%. 04, 36 cases, 12%. 05, 26 cases, 8%. 07, 16 cases, 5%. 08, 54 cases, 17%. 09, 77 cases, 25%. 18, 16 cases, 5%. 19, 37 cases, 12%. 28, 6 cases, 2%. 29, 15 cases, 5%. And 51, 16 cases, 5%. The week of February 7th, there were 531 cases. The week of February 14th, 593 cases. The week of February 21st, 414 cases. The week of February 28th, 390 cases. The week of March 7th, 326 cases. And the week of March 14th, this week, 310 cases. We saw a decrease of 16 cases this week than last week. Again, we are looking forward to a continued downward trend in our cases. Cases by age group, 30 and under is 54%, 31 to 50, 27%, 51 and older, 19%. It's important to acknowledge that the 30 and under increased by 7%, and the 31 to 50 decreased by 7%, and 51 and older still is at 19%. Our highest month was December with the 4,496 cases. So far for the month of March, we have seen 948 cases. Cases by race, unknown, 21%, Asian, 2%, Black, African American, 16%, Latinx, 25%, and white, 35%. The 5 additional deaths were an 82-year-old Hispanic male, a 91-year-old Hispanic male, an 82-year-old white male, a 61-year-old white male, a 63-year-old Black male. As the mayor said, our condolences go out to the families who now have a gap in their family chain. So our condolences do go out. 3 clinics are scheduled for this week. St. John's Congregational Church has no appointments left, so that clinic is fully booked. We're appreciative of the community for registering. The South End Community Center we are doing on Thursday. And those links, I'm going to talk about the links in a second. Rna School will be on this Friday, the 26th, and then the Ray Jordan Center will be April 1st. The libraries and Ray Jordan Center will help register at the South End Community Center and Rna School. They have the links, and so they will be able to help. New North Citizens Council has the Rna link. They will be able to register individuals. South End Community Center, the South End Citizens Council, as well as the Forest Park Civic Association has those links, so they will be able to register as well. I want to be clear that the doses that we are using are social equity doses. We know in the city of Springfield what those areas are. I am going to say those zip codes, which is 01101, 01103, 01105, 01107, 01108, and 01109 are the primary zip codes where we have seen cases that exceed the average number, and those zip codes will be eligible for social equity doses. So if you fit one of the categories, and also it's important to know that today, restaurant, cafe workers, food, meat packing, beverage, agriculture, consumer goods, retail or food service workers, grocery or convenience store workers, food pantry workers or volunteers, medical supply workers, vaccine development workers, public works, water, wastewater, or utilities, sanitation workers, court system workers, judges, prosecutors, defense attorney, clerks, funeral directors, and funeral workers. So those individuals who fit those categories became eligible today So you are eligible to go to one of the social equity clinics if you live in the zip codes that I named. Please reach out to the libraries, Elder Affairs, New North Citizens Council, South End Community Center or Civic Association, East Forest Park Civic Association. We will also be standing up clinics with Behavioral Health Network this Friday. That link will be on the city's website as soon as it's created. So Friday, there will be another clinic with BHN and Lower Liberty Heights, and that link, again, will be on the city's website. Moving forward, all clinics we stand up in the city, the link will be on the city's website. So you will be able to go to the city's website and register or call one of the departments that I named to help you with assisting. We are in the process of solidifying our clinics. We are going to have permanent clinics so that we will not move. You will know every week where you can go and what's available. So it's important, while this week we are using 3 sites that we primarily will not be going back to immediately, but we will have sites in our neighborhoods that will be permanent sites, so you can depend on us being there every week. So that is our challenge, is to make sure we're getting to the number of individuals we need to have register. I want to also remind us that while we are focusing a bit on vaccine, we are still doing contact tracing. We still have positive cases, and so we continue to test, trace, and advise, isolate, and quarantine. We are still monitoring positive cases. I want to thank the Vax Force for an amazing presentation at our town hall. And while the regulations are being, or guidance is being changed a bit, we still know we need to wear our masks, watch our hands, and watch our distance. Thank you to the staff at the Department of Health and Human Services, to the South End Community Center, St. John's Congregational Church, and Behavioral Health Network. And we will be announcing more partnerships this week because we think it's important that we are in the community, are in the neighborhoods, that we also have partners who are willing to help us to vaccinate as many individuals in our city as quickly as possible. We know that vaccination hesitancy exists. We know vaccine resistance exists. Our challenge is to give you the credible information that's necessary so you can make an informed decision. We will continue to do that. We believe very strongly, from every public health, every scientific fact we know says that vaccines work, and we had not seen adverse effects that might prevent someone from considering to get vaccinated. So please, when the vaccine becomes available and you are able to be vaccinated, do that. There are new categories open up today that should encourage, and I'm encouraging those individuals, sign up, get vaccinated, because that will bring us to the point where we can resume some semblance of our normal lives. Thank you very much.
Thank you very much, Commissioner Carlton Harris. We'll now go into the public safety segment of the city COVID hospital 19 update. And we'll now start with the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi.
Thank you, Mayor. Good morning, everybody. This week at the fire department, we have 3 members out related to COVID, 1 positive and 2 are waiting testing. We're in quarantine now due to a close exposure with the other member. We had a new class graduate from the academy last week. We swore them in, so welcome to all the new members. And on Friday evening, we had a difficult fire on Woodlawn Street that we were able to extinguish before it spread to other homes. Everybody did a fantastic job on that fire. No one was hurt. So all in all, everything came out very well on that. That's all I have for this week. Everybody have a great week.
Thank you. Thank you, Mr. Calvi. And they did do an outstanding job. That could have been a domino effect. The houses in our area there are very, very close together. It's old housing stock. So to you and your men and that tight rope walking they did on a roof area, tremendous, tremendous. We'll now hear from Police Commissioner of the City of Springfield, Cheryl Clapper.
Thank you, Mayor. Good morning. The police department currently has 2 officers out with COVID, positive for COVID. And I will be encouraging the recruits that will graduate April 2nd, along with other members of the department who have not got their vaccination, to do so, so that we can continue being in 2-man cars and continue to have the lobby open to the public. I will express my desire that all the officers receive the vaccination. It was a busy weekend. On Saturday, about 4:25 p.m., officers responded to Commonwealth Avenue. There we located 3 adult gunshot victims. All have non-life-threatening injuries, and all were very non-cooperative with the police investigation. You'll see in the area this whole week from Commonwealth Avenue over to Dickinson and in Belmont, there will be an extensive increased police presence in that neighborhood. Also, Sunday around 10 a.m., officers responded to 140 Chestnut Street for a gun call. The person there with the gun ran into one of the apartments, and we activated the ESU, the Emergency Services Unit. A warrant was obtained, entry to the apartment was gained, and there we arrested 22-year-old Oscar Garcia of that address. He was arrested, the firearm was recovered, stolen property was recovered. He also had 4 warrants from across the state, including one for armed robbery. No injuries to anyone on that. The ESU is operated and led by Lieutenant Brian Bellevue, and to him and all the ESU members, that was a great job with no injuries. Sunday at 7:40 p.m., right in a busy intersection at Breckwood and Boston Road, we had someone open fire with an AK-47, firing 762 rounds. If you know anything about weapons, 762 round is a very high capacity round and has the ability to go through many objects. It's a dangerous round. They opened up on a vehicle, striking the vehicle about 10 times, striking the operator of the vehicle twice. Fortunately for the operator of the vehicle, once was in the arm and once is in the leg, and he is expected to survive. The operator of that vehicle is Mr. Kenneth Bynum, about 27 years of age, and as the mayor said, Mr. Bynum is a recorded gang member. He has about 56 arrests on his BOP form, so he's in and out of incarceration frequently. He was the target of the assault, and he was also very non-cooperative with us in the investigation. So we're concerned about retaliation for that attack. And again, the detectives are up there now. They're canvassing the area for any video. The strange thing to me during this assault is that this weapon was fired about 10 times, maybe more, and it was 7:30, 7:40 at night, so still light out, and there were 0 calls to 911. So if you witnessed this assault, if you have any information for us, we're in dire need for any information as to the kind of vehicle that shot at the vehicle, anybody involved. So if you have any information, the Detective Bureau is 787-6355, and they are currently investigating that. Last week, we had a successful week with dirt bike operations and taking them off the street. We seized 20 dirt bikes. We made 17 arrests. That will continue this week. We will put an end to this dirt bike. Springfield's not the place to ride illegally, to cause damage to other people's cars, or to harass people and scare them. When brought up about a place to ride, a park to ride, that's great, but the individuals that we are targeting are not those that are looking for a place to ride safely and conveniently. They are looking to scare, intimidate, and harass people, and that we have zero tolerance for. The class is on schedule to graduate April 2nd. I welcome 33 recruits. There were promotions made at the department also, and I'm looking to pin and have a ceremony for those promotions, well-deserved, also on April 2nd. That's all I have, Mayor, and thank you.
Thank you, Commissioner Clapper. As I stated earlier, and I look at the stats weekly, overall crime in the city of Springfield, and the guidance of Commissioner Clapper and our dedicated men and women in blue, overall is down 20%. The increase is in gun assaults. And the media report many a times, we arrest these individuals 1, 2, 3, 4, 5, 6 times. And our courts let them right back on the streets. Can't have it. Can't have it. And that's what the court system or some of the judges, they would not like this type of activity going on in their neighborhoods. I don't want it happening to my residents in my neighborhoods. Everything down, except those repeat violent criminal offenders. Guns, drugs, gangs, who we arrest left and right. And you heard the names, you're going to hear more familiar names coming out shortly too. What the hell does it take to hold these individuals? Get them off my streets. Get them out of my neighborhoods. If you want them out so bad, you take them in your neighborhoods then. Very aggravating. I'm sorry, Danny, to give you this type of intro. Without further ado, we'll bring up the Superintendent of Schools, Dan Warwick, and he'll update you on a lot of things as we start to move back and getting our students and teachers back into the system. Superintendent of Springfield Public Schools, Dan Warwick.
Thank you, Mayor. Morning, everyone. Our meals program, which has been going on over a year now, and during the last year since we closed schools down, we provided families with 6,697,080 meals. Again, we're doing weekend service, and on this weekend alone, we did 79,500. We're going to be opening schools on April 5th for our elementary students, pre-K to 5, grade 6, our high-need SPED students, our SLIFE students, and our vocational students for vocational only at Putnam. During that first phase, we'll be bringing those students back. For pre-K to 5, it'll be hybrid, so they'll be coming in Monday, Tuesday, and every other Wednesday, or every other Wednesday, Thursday, and Friday. And then moving to full 5 days on May 3rd. We were able to get a waiver to keep them hybrid to phase that in. On April 26th, we're going to phase in our 7th and 8th grade in our middle schools. Again, they'll start on a hybrid on April 26th, and then on May 10th, they'll be going in 5 days a week. The state has not announced yet when they're going to talk about bringing high school students in. Because high school students have to move from room to room, it's a more difficult situation, and quite honestly, across the Commonwealth hasn't been very popular with the kids because a lot of it is almost remote from the classroom, so it's not something that they're going to look forward to. For our staff, the pre-K to 5 and 6th grade staff, special ed, SLIFE, and VOC, those staff are going to report March 29th. All other staff is going to come in April 5th. Those staff will be working, doing their remote, but from their classroom until the kids report to school. During the last several months, we've worked hard in many fronts. We're working hard to provide vaccinations for school staff with cooperation from our Health and Human Services Director. And there's 4 dates that we've posted for teachers that are on the website. 327, 43, 410, 411. Again, that's for school staff only. So, again, trying to get as many people vaccinated as we can. And Helen's working with us to do many other kinds of programs to get, again, folks vaccinated. That's at the Eastfield Mall site. During the shutdown, the mayor provided with $1.4 million, and we've upgraded all of our ventilation systems. All of that work is now complete, so our schools are ready to go in a safe manner. We also spent a fortune on PPE, which is all in place for our staff. And again, the mayor provided all of that to us without taking money from the school budget, so we didn't have to lay off any staff. We're providing full services remotely. And to show you how good that's gone, our attendance rate is at 92.2%. So our teachers have really worked hard to keep the kids focused and on target with the online learning. So that's been going very well. Typically we're only at 93% at this time, so that's very good. Another thing we've done, and again with the mayor's support, we've provided all the technology to our students, but now we're providing some extra technology with DocuCams and an extra laptop for all the teachers to assist them with the remote teaching from the classroom, because they're going to be doing the remote teaching and the live teaching concurrently. So we've provided the technology they need to do that. We've also provided professional development to enable them to do that well. So we're going to be ready to go when the kids come back in. Fall 2 sports have started with a success. You saw Central had a big win. Again, I thank our Health and Human Services Director for all her help getting the kids back in. We had all the kids tested before the season started, and we're going to test them 2 more times during the year to make sure we keep them safe. But those are very, very important things. All the extracurriculars are very, very important for our kids. On our meals program, when the schools reopen on April 5th, we're going to keep our meals program going because not all the kids are going to be coming in. The students who want to stay remote are going to be able to stay remote. So we're going to keep our same 18 food sites, but just move the time to 4 to 7 in the evening. So any families that need food, we're going to keep those sites open for them. That's all I have. Thank you, Mayor.
Thanks, Superintendent Warwick. Yeah, Central Golden Eagles really took it to Minichog, 55-14. That QB, William Watson III, was slinging it left and right. And then running back, Miles Crawford, sophomore, already being recruited by D1, top-notch D1 schools. And he's a very good student, too. And Crawford, the running back, Miles, was running wild Friday night. So way to go, Central Golden Eagles, and keep up that good work on and off the field. Speaking of good work, it's the spring season now. A lot of work's going to be going out on our streets. And I'll now bring up the Director of the Department of Public Works, Director Chris Signola.
Mayor, thank you. DPW has 1 employee out with COVID. Some construction activities will be starting this week. Most will be starting next Monday, including work by Springfield Water and Sewer Commission, Eversource Gas, and our paving program that was partially completed in the fall and will now be rolling into this spring. Our yard waste season starts next Tuesday, so if it is your recycling day, beginning next Tuesday, please have your yard waste out. And as I mentioned last week, the DPW still has openings for CDL drivers and for traffic signal technicians. The advertisement for the CDL drivers, I believe, is through tomorrow. So if you are interested, we have had a number of calls last week after we put out an alert that we needed some. So hopefully we can have some more people apply for the projects. We are continuing doing potholes. Our winter season ends this Saturday. We will be going from 3 shifts back to primarily 1 shift. And again, anything that comes up with regard to the residents of Springfield, please call 311 so that we can respond to it. That is it, Mayor. Thank you.
Thank you, Director Signoli. I want to thank the media because I know that Director Signoli Attorney Bill Mahoney had about 6 or 7 inquiries for CDLs this morning. When I came in, I had an email for a CDL driver. So thank you to the media. We still need those traffic control technicians, but thank you again to the media. And continuing, he has his hand in a lot of the different pies across the city. Patrick Sullivan, the Director of Parks and Facilities Management, he and his team have done yeoman work, especially on the physical plant improvements of ventilations above and beyond the ASHRAE standards for the schools and city buildings. The Director of Facilities and Parks Management, Pat Sullivan.
Thank you, Mayor. We have 0 out with COVID, and congratulations to you and Commissioner Helen Colton-Harris for getting us to the yellow zone. As Superintendent Warwick has stated, schools are now ready to be opened, and we're very thankful again to the Mayor, Helen, the Superintendent, and Finance Director TJ Plant for providing over the $1.4 million for the work, and to our facilities trade staff, John Kerrigan, and our industrial hygienist, Bob Kirchner, for getting us to this point. So for some good news, as you have heard, the governor is opening the state up for events. So we are preparing our park permits and ready to work with organizations and individuals for events throughout the park system. And the Park Commission, at the request of the mayor, has taken a look at its prices for the carriage house for weddings. As you know, there hasn't been really weddings in the past year. So they've taken off almost $1,000 off the rental of the carriage house, and we can now do 150 people in the tent under the governor's guidance. So on a Friday evening, it would be $1,550 to rent, and that's all inclusive tables, chairs, and if you needed to use the back pavilion for a ceremony. Sundays would be $1,750, and Saturdays and holidays would be $2,500, and again, that's all inclusive of the tables and chairs. And then I just finally want to thank Commissioner Clapproot and Sheriff Cochi. They've worked out to do patrols in the parks, which is it's invaluable, and we've got a lot of weekly thank yous from the residents who use the parks. And I just want to thank the commissioner, because that wasn't always the type of relationship that we've had. You know, police wanted to just do their thing and not allow other law enforcement in. So thank you, Commissioner, for being open and making that happen.
Thank you, Director Sullivan. And again, as I always say, Springfield's in the business of doing business, and Chief Development Officer Tim Sheen is here. He's working on a lot of stuff. We're very hopeful. He's going to speak about some national metrics, but we want to continue to set the table. We'd love to have the roaring 20s or the 1920s without the 1929 stock market crash. And I think we need to be prepared. There's a lot of pent-up anxiety and excitement once we defeat this COVID-19, and we're going to be ready to rock and roll. The Chief Development Officer of the City of Springfield, Tim Sheen.
Thanks, Mayor. There were a lot of good metrics as to the larger economy in the United States that came out last week. One in particular is that hotel occupancy rose above 52%. In a good time, that would be a disastrous number, but it's the highest number that we've seen over the past year since COVID. Consumer confidence increased after the American Rescue Plan was signed by 2.7%. And the Conference Board updated its 2021 annual GDP growth projection by 5.5%. Finally, the United Nations raised its forecast for global economic growth in 2021 as governments step up COVID-19 vaccination programs and keep fiscal and monetary stimulus measures in place. All of that is boding well for how the economy will recover as we go into the post-COVID environment. Both TJ Plant and I are closely monitoring the Relief Act funding for the city, and we were pleased to see Secretary Yellen's comments to the National League of Cities last week. The Secretary stated, with regards to the city and state funding, in the coming days, our Treasury team is going to work to get this aid out in the quickest way possible, and one that produces the greatest economic impact. Non-COVID related issues, as I indicated last week, the Gemini RFP responses were due on Friday. We received one from Home City Development, which will be reviewed by the review committee. I should stress here, with regards to development on this particular site, we are very focused on the support of the neighborhood for any development on that site. The mayor has asked the Development Services Division to prepare an RFP for a third party to provide comprehensive technical assistance to minority contractors and vendors. We will be working on preparing that scope this week and releasing an RFP as soon as possible. That's it for me.
Thank you, Director Sheehan. You already received the report from City Solicitor Ed Pakula. I gave you a briefing there. Financial report from CAFO, TJ Plant, and HR Labor from Attorney Bill Mahoney. I gave you a brief report. So with that, if you have any questions or comments on my cabinet heads, myself, Paul? Sure. Superintendent Warwick?
When you return to the in-person learning in April, will the students be spaced 3 feet apart or 6 feet apart?
The guidance from DESE allows you to go down to 3 feet now, but we're starting hybrid and we're going to be keeping the kids 6 feet apart, even though we don't have to, given the guidance. But we want to be extra careful.
I'm sorry, will that be the case when you go back to 5 days a week as well?
We think in most rooms it still will be, because about 50% of our kids, only 50% will be coming in. So we think we'll still be able to keep 6 feet apart. We're going to try to stay as close to 6 feet as we can, but we might not in all cases.
Well, I think you answered my next question, that is, what's been the opt-out rate in terms of parents who decide to remain with both?
Great question, and it's been running pretty consistently with the early groups at right around 50%, and most of the groups I saw by grade level were like 48 to 52%. High school, we're doing the polling last because we're going to start later, and I think with high schools, because the kids can't move around the high school and it's not a traditional experience, it's going to be even lower than that.
Now, you indicated that the teachers are going to be teaching both remotely and in person simultaneously.
Yes. Yeah, so the kids will all keep their same teacher they've had all year for remote, and we'll have the classroom set up so they can teach the students remotely and the ones that are in person simultaneously, so there'll be good continuity of instruction for the children. Any other? Great question. Great question. It's going to be very different from last year, but we're going to offer both live programs and remote programs. So families who want to send the kids in, we're going to offer live, and those that want to keep them home, we're going to keep up the remote programs that we offered last year. So we're going to be offering both, Matt. And we're going to expand our summer programs, because there's been a lot of learning loss, so we're going to really expand those programs to make up for that learning loss.
There is funding in the American Rescue Plan for like kind of catch-up programming over the summer, if I'm not mistaken, or at least there's funding you could use for that. Are you starting to tap into those resources as well?
Absolutely, yep. Have had a conversation actually with a congressman, and this Relief Act is going to be very favorable for the schools and for the city. So we're going to have the resources to do what we need to do. I'm very, very grateful to our congressman and all the support we've received, because the kids are going to have missed a lot. We've been through a very, very difficult situation. So we're going to really need to put a lot of resources in place to catch everyone up again. Not just the academic issues, but also we're going to have to be very conscious of the mental health issues that have stemmed from this pandemic. Thank you.
Thank you, Superintendent Warwick, and Dan and his team continue to work creatively on graduation aspects too, so stay tuned on that. I appreciate that, Dan. And as I stated with our school empowerment zone board and our school system overall, on this extended learning on mental health counseling, extracurricular activities. as a hook too. And I think that's important too. Eric, I know Audrey had a question, or? Yes, there are, and again, if we can continue this trajectory of knocking down the COVID-19 and getting to certain zones, yes, we spoke about that late last week and actually earlier this morning with Mass Mutual Center, Symphony Hall, City Stage, following all the proper criteria. If certain types of shows could start. Again, you know, they have to look at the bottom line, but we are having discussions on that, and knock on wood that the trend continues to go, that the rate is going down. So we are looking to do that. Mass Mutual Center can open up at 12% of their capacity. Symphony Hall will now have capacity. And of course, with the City Stage, we're in a transitionary period. They're bringing Focus Springfield over, but eventually we'll look to do more intimate shows there. And it's Symphony Hall and Mass Mutual Center, again, that'll be working with MGM also on it. So that is the discussions have already started to see what can be brought to fruition, to be done. And again, you have to look at their bottom line on these shows and these acts too, and then hopefully we'll get to phase 4, step 2, and beyond, and that allows for even more relaxation of any type of requirements. In the meantime, though, we still do need to follow the prerequisites of the COVID-19 public health regulations. So I think it is still important when you're out, especially out there in public, to wear that mask, to, you know, socially, physically distance where you can, continue to, you know, wash your hands. I think that's extremely important. And the more and more people that get vaccinated, the more and more you're going to be able to spend time with he or she on it. So our goal right now is shots in the arm, shots in the arm, shots in the arm. Any other questions or comments? Matt? Sure. Mr. Carlton Harris, please.
So the cases increase that we saw last week was due to an increase in cases in an institution of higher learning in the city of Springfield. And so that's where I saw the most increase in the cases. I have not seen the increase based on St. Patrick's Day or any other large gathering that I can point to at this point. That it was very specific to an institution of higher learning.
And just as far as when you're getting data as far as the deaths in the city, is that still being a few weeks behind the current date? And as far as you know, is that also the same case when the state is daily county data? So is that also like a couple weeks behind? Is that like
So our data comes from the first place that a funeral director must go is to get a burial permit. So we get the burial permits and get the data off of that. There is another set of data that is filed with the city clerk's office, but our data is primary data, not secondary data. And so I am not sure how far behind the state is. I can tell you that the last data that I reported to you today was from March 10th. So we will see other increases potentially in deaths, but it does lag at least 1 week to 7 to 10 days behind. You're welcome.
Thank you, Mr. Carlton Harris. Any other questions or comments? Okay, hearing none. To the media again, to TV and to the print and to the radio media, thank you. You've been a great partner getting information out. Being designated in the yellow category now is a big deal. We want to get the green, and many thanks go out for my cabinet heads all the way down the rank and file, or medical professionals, to you, the residents and business community here in the city of Springfield, who have been patient, understanding, and have worked with us, been very, very cooperative. As I stated before, and Chris Signoli will like this, the traffic lights that we don't want to get knocked down in accidents. You know, red is stop, yellow is be cautious, and green is go, baby, go. We're at yellow, so we have to stay cautious and we have to stay vigilant. I promise you that Helen and myself and the rest of the city team will continue to give you sure and steady leadership as we move to defeat this COVID-19. So to each and every one of you, good health to you and your families. Go out and have a great day, and God bless. Thank you very much.